Hello everyone. Welcome back to the Texas A&M Dermatology Interest Group Residency Program Series podcast. My name is Shiva. I'm an M4 at Texas A&M, and today we have the pleasure of speaking with Dr. Rachel Graubard. She is a PGY4 at University of Texas Health Science Center in Houston. Hi, Rachel. Welcome to the podcast.
Thanks for having me.
Yeah, of course. So we'll just get started. Just tell us a little bit about yourself, where you're from, where you did undergrad, med school, all of the fun things.
Like Shiva said, my name's Rachel. I am a PGY4 derm resident at UT Houston right now. I grew up in Houston. I've been here almost my whole life. I went very far away from home to Austin for undergrad with Shiva, and I went back to Houston for medical school at Baylor College of Medicine, and I got lucky enough to stick around for residency at UT Houston. And my journey in dermatology started pretty early on in life. My grandma's uncle was a famous dermatologist in Europe. He first discovered and coined the term for necrobiosis lipoidica. So I grew up looking at his medical journals, and that sort of piqued my interest, and I've wanted to be a dermatologist ever since. So I really feel like I'm living out my dream.
Wow, so cool. Can you tell us if you did a research year and also where you ended up doing your intern year as well?
I actually went straight through. I didn't waste any time. I did undergrad, med school, residency, and then I did my intern year at Baylor, where I was for medical school.
Okay, awesome. All right. Do you want to tell us a little bit about some things that you like to do for fun in Houston, things inside, outside of dermatology that you enjoy doing?
So I have many hats in life, but when I'm not a derm resident, I'm a fitness instructor here in Houston. I teach at 3 different gyms. I teach indoor cycling classes, and I teach Zumba classes for fun. So I'm really passionate about health and fitness in general, and I love going on hikes. Anytime I'm on vacation, you'll probably find me somewhere in a mountain where I can hike or fish. That's one thing I really like to do. Always make sure I'm wearing my sunscreen. And then I really like to explore new restaurants here in Houston. We have great food anywhere you want to go, any type of food. It's just great to discover new things, and I'm always down for a little adventure.
Awesome. I love a good hike too. Okay, so we'll talk a little bit about your institution. Tell us just like broad bird's eye view about UT Houston. What other clinical sites are affiliated with you guys? Number of residents, number of faculty. Let's just start there.
Okay, so it's a very big program. I'd say probably one of the biggest ones. We have 21 total residents, but we're spread out over many different sites. So it's very cool. I think our program is unique in that it's a dual combined residency. So not only are we UT Houston, we're also affiliated with MD Anderson Cancer Center, which is the largest cancer center in the hospital. And we're within the biggest medical center in the country. So we really get to see anything and everything you could imagine. You'll see it here in Houston. Every type of skin, every condition you could possibly imagine, will have it. People travel from all over the world to be seen at hospitals here in Houston. So I don't take that for granted. It's such a privilege to be able to train here. So we're spread out all over the place. We have our private insurance clinic, which is in Bel Air, a little suburb in Houston, where we rotate. We're at our county system. So we rotate at LBJ Hospital and Smith Clinic. So we serve the underserved population there. We also rotate through MD Anderson, like I mentioned, and we're at Memorial Hermann as well.
Cool. Wow, lots of big names affiliated with UT Houston, which is very cool. And then, so 21 residents, PGY 234. Do you guys have any fellowships at the program?
Yes, so we have a DermPath Fellowship. Dr. Rapini is the chair of UT Houston Dermatology. He's a very big name in dermatology. He wrote Rapini Dermatopathology, and it's a huge honor to train with him. Reading at the scope with him is truly, truly incredible experience. I can't say enough about it. So his fellow is very lucky. You get great training in DermPath. And then through MD Anderson, we have 2 Mohs fellowships as well. We also have Dr. Aber, who's our pediatric dermatologist. She takes on 1 to 2 research fellows every year for people who really want exposure. before applying to dermatology. She's a huge name in dermatology as well, and she's a world expert in pediatric dermatology and vascular malformations, and she runs several clinical trials. So she's always busy, always doing everything, and it's a really amazing opportunity to train with her too, even just as a research fellow.
So while we're on the topic of research fellows, is that the only research fellowship for UT Houston, or do you guys have other faculty members who run research fellowships?
So we have Dr. Tearing as well. He's actually a volunteer faculty member, but he works very closely with the residents. He's always looking for opportunities to involve us. He's one of the developers of the Shingrix vaccine. So he's an expert in infectious dermatology, and it's really cool. And he takes on a research fellowship every year as well.
Okay, cool. I don't know if you would know this number off the top of your head, but do you know generally how many faculty members there are for your program?
So there's 18 at MD Anderson and I think 7 at UT. So combined, it's a big
Okay.
faculty.
Okay. Yeah, that's a lot of faculty for a lot of residents, so it works
Exactly.
out. For the research fellows, like the PEDS ones and the ones that work with Dr. Tearing, does UT Houston tend to accept their research fellows? Does it kind of just depend on the year, or do they end up going to other derm programs?
I think it just depends. Usually they do very well there because they're very strongly recommended by big names in dermatology. So it really just depends on your resume, not just and your performance as well.
Okay. I know you only know mainly about the people that are in your cohort or, the adjacent cohorts, but how does your program view people who have a PhD or who have done research years versus those who are coming straight in, like you?
I think we view everyone on an even playing field. We don't really think of you as any higher up just because you have extra degrees or because you did research. We look at you as a whole. But we do really value the people that we work with in person and we get to know over a period of time, whether that's our own students, people that come with us and do away rotations, or people that do research fellowships. It does say a lot when we know what you're like in person and we enjoy working with you. I think that's a big plus. But as far as extra degrees, research years, it really is just what you want to do and what you're passionate about. If you want to do a PhD and get that extra training and do some research and make a big name for yourself, I think that's another really great thing. But as far as applying to dermatology, I think in our program, at least, I would say everyone's on an even playing field. It's really just about who you are as a person as a whole.
Okay, awesome. And then last question kind of within this realm of questions. Do you know if your program accepts DO students or IMG students, if that's something that you've experienced or unsure?
I can't speak for in the past, but as of right now, I know we don't have any.
Okay. Okay. All right. We're going to jump into some training questions.
What?
If you can tell us a little bit about the structure of your program in regards to rotations, is it like longitudinal, block schedule? Where do the electives fit in? What is the general, structure of the program?
So I'm administrative chief this year, so I do all the scheduling. So we are on a block rotation schedule. It changes every month. So you're assigned basically to a clinical site for the month, whether that's a Harris Health site, our county system, MD Anderson, our UT system, or you're one of the consult residents seeing inpatient consults. So everyone is assigned to a rotation, and that rotation differs throughout the week based on which attending you're in clinic with, if you're seeing patients in the hospital for consults, if you're in our surgery clinic, if you're doing Mohs. It just depends on the rotation. Each rotation has an assigned day of the week that you're doing something in particular, but based on coverage needs, we do have to change you around. So it's almost like every week you're probably never in the same place that you were the week before.
Okay. Lots of variety.
Yes.
Okay, great. And then for electives, how does that work? How long are elective times? Is it also a month of electives?
I wouldn't really say we have elective time. We have a dedicated derm path rotation your second year. That's a month to 2 months, depending on where you fall in the rotation schedule. We have 7 residents, so 7 different rotations per year, 12 months per year. So you do all but 2 rotations twice. So you do a month of derm path, and then we do rotate through derm path every once in a while, just based on your rotations. If there's no need for coverage in another clinic, we might send you to derm path for the afternoon just to do extra or get extra exposure. But electives, we do have a free float half day per week that we use to explore our interest in derm. So you can reach out to people in the community if you're really interested in cosmetics and get more exposure in cosmetics or in pediatrics. Just really what you want to do with that time is up to you. For me, I took a week of vacation and I went to Guatemala my first year, and I did like a volunteer trip where I saw over 250 patients and I treated derm conditions there, and I thought that was really awesome. But you kind of have to make your own electives.
Okay. That does give you a lot of flexibility though,
Mhm.
because then you can just, like you said, make of the time what you want to make of it.
Exactly.
Do residents spend time on other services? Like, is there any time you're spending time with like plastics or medicine residents at all?
We have medicine residents from Baylor that rotate through our clinics as a derm elective, so we do get some interaction with them. But as far as us, we don't rotate on other services.
Okay. All right. Tell us a little bit now about each clinical site. You kind of referred to MD Anderson, the UT system, and the county. Tell us what those experiences are like, the types of patients that you're seeing, what kind of insurance is coming through. So let's start there. And then after that, we'll kind of talk about how far you drive and stuff for those.
Okay. So I'll start with MD Anderson. It's probably our biggest and where you spend the most time as a first year. So you can be all over the place at MD Anderson. So we have our melanoma and skin center there where we have a CTCL clinic, which I think is very special. We get training in cutaneous T-cell lymphoma that probably a lot of other programs don't get. We see so much of it, and we're very well trained in treating that, for better or for worse. We have an incredible faculty member, Dr. Hewen, who's a world expert in CTCL. So people come from all over the world, Dubai, Peru, Ecuador, just to be treated by her, which is pretty special. So you get very confident in treating CTCL. And then we do lots of just bread and butter skin checks at Melanoma and Skin Center. People that we see at MD Anderson are usually patients with some type of malignancy, not necessarily skin, but we do see them for regular skin checks because some cancers are associated with higher risk of skin cancer or developing skin cancer secondarily based on, medical treatments that you're on or just the cancer inherently. And then we see a lot of patients with a large, long history of non-melanoma skin cancers and melanoma skin cancers there as well. And then we have our prevention center clinic at MD Anderson, which is usually patients from the community that get referred for regular skin checks. They may or may not have a history of skin cancer, but we just do skin checks there for them. And then we also have our MD Anderson inpatient consult resident. That's a rotation that you do only as a third year. It is pretty demanding. You're probably going to be at the hospital for long hours because we get lots of consults every day because it's a huge hospital and there's lots of rashes, lots of lesions that we need to check out. So that's a dedicated month that you're just the inpatient consult person at MD Anderson. And then we have our Bel Air clinic, which is usually private insurance patients who just see their regular dermatologist. We do a wide variety of things there. That's where we have our pediatric clinic with Dr. Aber. We do gen derm there, skin checks as usual. We treat complex medical dermatology patients. We have Dr. Klimas, who's our expert in derm room. So you get to do a lot of that as well. And then we do some cosmetics. We have Botox, we have filler, chemical peels, and we have an IPL laser there as well. And we're working on getting a V-beam, which I'm very excited about. And then, like I said, there's the county system. So there's one resident that's dedicated to being the LBJ inpatient consult person, but you also are in clinic throughout the day during that one because it's not quite as intense. So that's typically a second year resident. So we rotate through 2 different clinics within the Harris Health system. It's our underserved population. So these are patients that have what we call the gold card. It's kind of a subsidized insurance system for patients who are eligible to be covered by it. And so we see those patients. We get a lot of autonomy in those clinics, which is really great. We staff everything with our attendings, of course, but we really get to be the people making the plan. So it's second and third years that rotate through those clinics. Usually it's a gen derm clinic, and then once a week in the mornings on Tuesdays, we go to LBJ and we do surgeries for patients who can't have Mohs or procedures like that through private insurance. Then we have our Mohs center, that's through MD Anderson, I forgot to mention. We have 3 incredible Mohs surgeons, 2 Mohs fellows. We get tons of exposure to surgery starting out in first year. So you get really confident in your surgical skills, which I will say is a great skill to have right off the bat, because you're going to want to know how to do what you need to do and sewing up. So I really do enjoy getting to work with them and getting trained in suturing and just managing complex tumors and learning even how to close things that you wouldn't even imagine we can close. Let me think. I think I got everything. Oh, and then Memorial Hermann. There's one resident, usually a second year, who's dedicated to seeing consults in that hospital. And again, they see patients during the day in clinic, and then they see consults in the afternoon.
Okay. So you guys do have a county, but you don't go to the VA, correct?
We do not have a VA. So Baylor is the other residency program in Houston, and so they go to the VA here in Houston.
Okay. All right. You talked about pediatric experience with Dr. Abear. Is she the sole pediatric dermatologist? Do you feel like now that you're kind of nearing the end of your last year, or end of derm residency, starting the last year of derm residency, do you feel like you've gotten good pediatric derm experience?
Oh, absolutely. I mean, training with her is probably the greatest privilege I've had. She's incredible. She does everything. She takes call for pediatric patients 365 days a year. Anytime you're on call, if you see a pediatric patient, you let Dr. Abear know, and she'll come to the hospital and see it with you, and she'll teach you so much. I personally love pediatric dermatology, and I always want more exposure. I'm hoping that I can, do a lot of pediatric in my regular practice once I'm outside of residency. But I feel so confident and so well trained just because Dr. Abear has taught me so much, and we get some of the best, I think, training in pediatrics because she's a great resource.
That's awesome. That's great to hear. So now that you've talked about the sites, can you tell us what the driving is like? Are these all in downtown Houston? You talked about a relocation in Bel Air. So what is the transportation like?
It's pretty manageable. I mean, it really depends on where you live. So I lived very close to the medical center my first 3 years of residency. I'm very close to Bel Air now. So it's like a 5-minute drive from my house. But if you were near the medical center, you're 5 to 10 minutes away from Memorial Hermann, MD Anderson. They're all in the same place, and our Mohs Center as well. LBJ is a little bit further north from us, so most of us do have to make quite a drive there. It's about 20 to 30 minutes on the way there in traffic. We have didactics in the morning, usually 3 days a week. So we do get out of didactics at 8:30, and we're expected in clinic at 9 o'clock. So 30 minutes is plenty of time to get there. That's probably the longest drive that most of us have to make. Everything else is pretty within, it's what we call inside the loop. So not too bad.
Okay. Okay. Awesome. Yeah, if you I remember going to Texas Medical Center one time, and it's just like once you enter that loop, you're like, wow, this is so much is happening
It's
here
all
with
there.
many different programs. Yeah. Okay, great. So we'll go into the very classic question. Can you, from your perspective, tell us what the strengths of your program are, and in what direction your program is making improvements on as well?
I think our faculty is probably the biggest strength that we have. We have some really big names and some incredible people to learn from in basically every realm of dermatology. So I think that is my favorite thing. Not to mention we have so much support in dermatology because we have 21 residents. So we take very minimal weekend call, which is wonderful. The workload is really spread out, and we always have coverage because we just have so many people to help us out. And I think that's one great thing about it. And it gives us the flexibility to have that half day of academic time per week to explore our interests in derm on our own accord based on what we want to do and not just what we are scheduled to do. So I think that's probably the main strength of our program. And then as far as improvements we're making, I think our program is very adaptable and receptive to constructive criticism. So I think one thing was driving in the past was a little bit more. People were going out to satellite sites in the woodlands. So we don't do that anymore, and we're trying to scale that back. Our parking is all paid for, which is really nice. So based on ACGME survey results, they're always listening to what the residents have to say, and they'll make the changes that they need to.
Okay, awesome. That's great to hear. You touched on this a little bit earlier, but can you go into, we're going to talk about surgery experience for a second. When do you start doing procedures? Where do you start doing them? And, I know there are some programs that there's no Mohs fellows, so they're doing so many closures by themselves. So tell us how that works for you guys.
We start rotating through the Mohs unit almost a week one, in first year, we're there a lot during first year because we really want people that do maybe have an interest in Mohs to be able to explore it right away so that they can make the preparations. It's a very competitive subspecialty. So if you want to do Mohs, we want people to be prepared and start as soon as possible. So we're in Mohs from basically week one. Clinics may have excisions scheduled based on your attending, and so you get to do a lot of procedures. We have an excision clinic at Bel Air once a week, and we have an excision clinic at LBJ. Only second and third years are at LBJ because we get to do everything pretty much from start to finish. Our wonderful Dr. Thomas is one of our Mohs attendings, and she will help us formulate a plan. She's always there if we need her to be, if we run into trouble or we just need an extra hand, but we really get to do so much on our own and really learn how to close even really complicated cases at LBJ, which is wonderful. But we have so much guidance when we need it. So tons of procedures that we do. And I think by the end of first year, I was already pretty confident in doing regular excisions. Now that I'm a third year, now I feel even more confident in doing a little bit more complex excisions or closures. So once you build it up over time, but it gets there.
Okay. Awesome. Great to hear. I know there's a lot of difficulty finding surgery experience in certain programs, so it's good to hear that UT Houston, you're getting a lot of exposure from the beginning, especially for the people wanting to do Mohs. And then tell us a little bit about cosmetics. You talked a little bit about the Bel Air clinic, and there's an IPL laser and Botox and filler and stuff, and then you can make your own kind of cosmetics clinics too in satellite centers. So can you tell us how much training you get, particularly in that?
So we have cosmetic clinics. Usually third years are staffing cosmetic clinics with attendings during the week. And then we do didactic sessions every Thursday afternoon. And so once a month, one of those didactic sessions will be cosmetics dedicated. So one of our faculty members will come in, or someone from the community will come in and teach us a different skill. We'll bring in our own patients. We'll ask them to demonstrate. We do Botox, we do filler, we practice doing filler with cannula or with needle, lasering, chemical peels, subcision, TCA cross, things like that. So we really get to do a lot over the course of 3 years. And then Dr. Thomas, one of our Mohs surgeons, will do Saturday morning sessions with us where we can bring in friends and practice our cosmetics on them as well.
Awesome. And I'm sure the friends appreciate that as
They
well.
love it so much. And
Yeah.
we're very lucky. We have cosmetic grants so that we get a lot of practice product to use. So we can bring in friends to use our practice product on. I've done lots of lip filler for friends, Botox, things like that. So through those grants, we get so much fun stuff to play around with.
Nice. Okay, great. Do you guys have a continuity clinic or a senior clinic?
Yeah, so we have a continuity clinic, our Smith clinic. Every resident is assigned a week of continuity clinic per month. So everyone goes to Smith clinic one Thursday out of the month that they're assigned to. So whenever we see patients in that clinic, we can schedule them for follow-up with us.
Okay, nice. Okay, great. You touched a little bit on your trip to Guatemala and talked about how you set that up yourself. So tell us about the global health opportunities associated with your program. And if not, if there are no official associated ones, how difficult was it or easy was it for you to set it up yourself?
So it's not affiliated with my program, but one of my attendings is very passionate about those trips to Guatemala. And so he usually sends residents every year. It's through an outside organization called Faith in Practice, and one of the UT internal medicine doctors organizes a trip twice a year to go. there's not always a dermatologist that can go. So it was a trip with internal medicine, with pediatrics, with OB, and then I was the sole dermatologist when I went. And usually we're just looking for volunteers to go. It was really easy, and my attending actually funded my trip because he really wanted me to get that experience. And so again, I have so much support to explore the things that I want to do. So just if you find your niche, you just look for it and you fill it.
Yeah, and especially when you're at a big medical center, there's bound to be an attending who's interested in the same thing, so
Exactly.
they can
Yeah.
set it up with you. How much autonomy do you get as residents? I remember hearing that you said you're setting up the plan with Dr. Thomas for Mohs. So just in general, do you feel like you get a lot of autonomy? Does it kind of depend on what year you are?
Definitely depends on your clinic site, I will say. So, at UT Dermatology at our Bel Air clinic, we don't have the same amount of autonomy just because these are our attendings patients that they've been seeing for long periods of time. We're kind of just there learning, and we see the patients, we discuss our plans, but we have to run everything by our attending. And then once we get up in our training, we go to Smith Clinic and LBJ where we have much more autonomy and we're really formulating the plan ourselves. Of course, we always run everything by attending, so we have a lot of support and a lot of guidance, but the hand holding I feel has kind of eased up as I've increased in my training. So now that I'm a third year, attendings kind of just let me say what I want to do and they're like, yeah, I think that sounds great. So once you get comfortable learning how to manage different things, they know that you're capable and they trust you.
Okay, amazing. And then last question within the training realm, and then we'll move on to the next topic. But can you tell us a little bit about how the consult service works and how often you're taking call throughout the year?
So weekend call is split up according to, we start with the the third and second years. They take the first few months of call up until Thanksgiving over the weekends. So you cover 5 weekends of call your first year, 2 weekends of call your second year, and then 1 weekend of call your third year. So the upper levels are carrying the call service on the weekends the first few months up until Thanksgiving, and then we let the first years take it away after that. They cover 1 holiday and 4 weekends. And then the upper levels do the first part of the year. So it's actually really nice once you get past that first year and you're not taking call as much. I'm done with all my weekend call as a third year, which is wonderful. It can be a very busy service, so people should know to be prepared to go in probably both days of the weekend. Just because we get a lot of consults, usually at MD Anderson. The other two are kind of a little more quiet over the weekend, so not as busy, but it can be a pretty demanding consult service. Like I said, MD Anderson, we have a dedicated rotation to that. So morning and afternoon, you're scheduled to be the dedicated MD Anderson consult resident because you will be getting quite a bit of volume of consults. Some complex, some not so complex, some might require a biopsy, some might not, but you just never know. With Memorial Hermann and LBJ, you're seeing patients in clinic in the morning, and then your afternoon is dedicated to going to go see consults. So it's a little less busy. So those are second years that are covering those two hospitals, and a third year covering MD Anderson during the week. First years cover call from 5 p.m. to 8 a.m. in the morning on weekdays. 5 p.m. to 8 a.m. on weekdays. You cover 8 weeks at a time as a first year. Night call is usually very minimal. You don't get too many calls, maybe a surgical patient that's bleeding. They just want reassurance that everything's okay. You forgot to send a prescription, so the patient was calling the on-call answering service, so they paid you, those kinds of things. Rarely you might get a call for SJS overnight that you would have to go see, but few and far between.
Okay. And then those 8 weeks, they're back to back for those residents. Okay. So they just get it all
Yeah.
done at the same
So
time. Okay.
Monday, Tuesday, Wednesday, Thursday night, and then Friday night is the on-call resident for the weekend.
Okay. Got it. Okay. So next topic is research. First, we'll just talk about if you guys have any research requirements for residency.
We just require one scholarly activity per half of the year. So that could be a poster at our Texas Derm Society, an abstract, a publication, or just something that you have in the works. We do in second and third year get dedicated time to pursue our research project. So that's really nice, but it's a very minimal research requirement. You can do just about anything.
Okay. And how difficult or how easy is it to find research?
So easy. MD Anderson, there's tons of trials going on. Just ask an attending what they're working on, and it's there. Even at med students, they get on all of our really intense clinical trials or chart review projects. So always opportunity. We have so many attendings that are very passionate about research and are doing big projects. So always, always opportunity.
That's great. That's great to hear. And last question in the research realm, what does support look like for getting grants or going to conferences? Do they pay for you to go to conferences? What does that look like?
We have each resident has $1,000 stipend each year to use toward scholarly activities, conferences, things like that. The rest comes out of our pocket if we need to for attending conferences. But as far as research goes, we always get donations from alumni that help, which is really nice. And just our attendings are very generous of time as well.
Okay. All right. Next topic is a little of a smaller of a topic, but an important one. Let's talk about exam prep for a few minutes.
Mhm.
You talked about morning didactics, like 7:30 to 8:30, and then you have clinic afterwards. So tell us about what the didactics look like first.
So we have morning lecture, like I said, Tuesday, Wednesday, and Friday mornings, 7:45 to 8:30. We usually collaborate with Baylor with our morning didactics. So we hear from their faculty, they hear from our faculty. So we really get to see a lot of really cool lectures in the morning and we learn so much. Then our Thursday afternoons are dedicated to didactics. So we only work a half day of clinic Thursday morning. And then we're in lecture the rest of the day on Thursday. Sometimes that's in person, sometimes it's virtual, but we usually do 1 hour of derm path. We are a very derm path heavy program here because we have Dr. Rapini and we have so many wonderful derm path attendings. So we do derm path. Our first years are really put on the spot right from the jump, and they have to describe some derm path unknowns and give a differential. And then we usually cover some of the Bologna chapters as well. And we do the consult resident will give their consult lecture once a month. And then we have lots of just other really cool lectures throughout the year, and it differs all the time. But like I said, and then once a month we have the cosmetic sessions.
Okay. Are the didactics more resident led or faculty led?
It depends. So our Thursday afternoon lectures usually always residents. So we are assigned chapters to cover throughout the year. And so we know when we're giving lecture. We'll do journal club with JAD CME articles or Kodachrome lectures. So lots of resident-led lectures, but then we also have faculty lectures throughout the week in the morning, more the morning lectures.
Okay. And do you guys get protected admin time for studying or for research?
Yeah, so that half day a week that we get is for whatever we want to use it for, exploring our interest in dermatology, doing callbacks, research. So not only do we have that protected time in first year and throughout, but in second and third year, we also get extra research blocks. So we get a little bit of time throughout the week to focus on our research, if we're, especially for those applying to fellowship.
Okay, awesome. All right, let's talk about program leadership.
Mhm.
So tell us about who your program director is, your chair is, if they've been there for a while or if they're newer. We'll start with that first.
We're going through a lot of changes right now. Dr. Rapini, like I mentioned, was previously the chair of both MD Anderson and UT. He has been with UT MD Anderson for 40 years. So August of this year, actually at the end of this month, he'll be leaving MD Anderson and focusing only on UT. He's cutting back on his roles, and we have an intern chair at MD Anderson, but he's still the chair at UT for now. And then our program director's name is Dr. Misha Koshelev. So we have lots of other people that we can go to, but we have Dr. Chan as the interim chair at MD Anderson right now.
Okay. The next question was going to be how receptive program leadership is to feedback, but I think we already discussed that earlier. So
Yeah.
I'm going to go to the next question, which is what role you guys as residents have in the interview and match process.
We work super closely with all the medical students throughout their away rotations, throughout their regular rotations for the UT internal student rotations. So we get to work really closely with them. We get to give feedback on them, but no formal role for residents in interviewing. That's all faculty led.
Okay. All right. So next topic is the fun topic, which is resident life. So we'll go through that and then we'll conclude with a few final questions. So
Okay.
tell us how you would describe the culture of the program, kind of what the personalities are like, what y'all's interests are. We know about you and your hiking and everything, but in general, with all 21 residents, what is the general vibe of the program?
I think we all get along really well. I think within each of our classes we're very close, but you also build really strong friendships with the people above you, the people below you. I still hang out with the residents that have long graduated just because I built really strong relationships with them before. Sorry, there's a siren outside my house.
Okay.
Um, and even now, especially me being the chief, I feel like the first years really need me all the time to help. And I love that role. I really love helping them. And especially as they were just starting, it's really nice to help pay it forward and do what the upper levels did for me. And I think that's really important. Um, we all get along really well. We do lots of social events. We have social chairs that organize things. We have a resident retreat where we really get to go. We go out to Galveston, which is about an hour away from Houston. We rent a little Airbnb and we just play games and we bond. We spend time at the beach and we try and find things to do together all the time. Like I said, Houston's a great food city. So a lot of us will go out to eat. A bunch of us just went out for sushi this week. So always finding little reasons to get together is the best because sometimes it's nice to see each other outside of work.
Yes. Yeah. And that was actually answered the next question, which is if you guys spend time outside of the clinic and hospital. So it sounds like you guys do.
Sure.
And I can also attest Houston has a great food scene. It's like one of those every single culture is represented. So,
That's right.
all right. Okay. So tell us about renting or owning a place. Do residents can they own a home? Is Houston a, like cost effective city for them?
For sure. I think mm, probably I'd say maybe half of our residents are homeowners just because cost of living in Houston is really manageable. And I think that's a great thing about Texas in general. So yeah, a lot of people choose to rent. I chose to rent the first 3 years and now I live at home with my parents, so that's great. Saving some money, but I think renting, home owning, everyone does just about everything. Living rent free, you can do it
Perfect.
all.
You got to take advantage of those times where you can
Yep.
save that money.
Mm-hmm.
So do most residents live closer to like Texas Medical Center?
I think people live all over. It's crazy.
Okay.
Some people have a little bit of a longer commute, but yes, I would say the majority choose to live closer to the med center.
Okay. Is there a housing stipend at all, or do you remember there being, I mean, I guess you didn't have to move since you were already in Houston, but is there any
Not that I
stipend?
know of. I don't think so.
Okay. Do you know in general, and maybe you might not know this, but it's fine, but if someone wants to just get like a one bedroom apartment in Houston,
Yeah.
generally how much are they spending for it?
So I would say my we lived in a one bedroom apartment so I guess I should say this, but yeah, so I lived with my boyfriend who's now in LA for fellowship. So we lived in a one bedroom apartment the first 3 years of residency and we paid about 2,000 a month. It was in a great area. It was right on the rail. So you had access to take the rail into the medical center and it was less than 5 minutes of a commute for me to get to MD Anderson or Herman. So in close to the med center, I'd say between 1,800, 2,400 in that range. A little bit further out, you could spend a little bit less, maybe 14, 1,800 again. So it's pretty reasonable for one bedrooms.
Yeah, definitely, especially for living in a big city. Texas it does have great cost of living. We talked about how it's necessary to have a car,
Mhm.
so we'll skip past that. What is the breakdown of residents being single, married, or having kids? Do you guys have a good kind of mix of that?
Everything, every walk of life is rented. So yeah, we have several that are married, several UT Durham babies that we absolutely love. One of our residents has 3 kids. She has twins and a brand new baby. Um, and UT is also very supportive about taking maternity leave, I will say. Um, And then we have people that are in relationships, long distance relationships. Both actually, me and my co-chief were both in long distance relationships this year. So we joke and we say we're a work wife and work husband. So everything is represented. Single. I think Houston is a great place for dating as well. You can always meet people. I met my boyfriend in the Bentop ER, so he's a resident. Or when he was
Nice. Oh, nice, nice. Okay. Well, you're doing a great job of answering all my questions because the next one was maternity and paternity leave. So it seems like they support you guys well
Yeah,
with that.
absolutely. Yeah, both. So we've had just in my 3 years so far, we've had, I want to say, 4 women take maternity leave and then 1 paternity leave. And it was the full 8 weeks, and they were very supportive about it. And there's really no issue. Like I said, the great thing is that we have 21 residents. So there's always room for coverage, and our attendings are also very reasonable and very flexible, and they're very supportive of us using that time.
Okay. Do you know if it's 8 weeks for both maternity and paternity leave? Okay. So let's just conclude this resident life part. We talked about how Houston offers a lot of good restaurants, and there's Galveston nearby, which is a beach city that you guys go to.
Mhm.
Anything else we should know about Houston, or any recommendations you have, any restaurants that you enjoy going
Oh
to?
man. Well, I will just say my favorite restaurant is Uchiko. It's I know. I mean, it's a classic because we had it in Austin too, but that's just my favorite place to go. It's so expensive, so it's really only for like special occasions, but you really do feel like you're treating yourself when you're there. Right now we have restaurant week, which is actually a full month of deals at restaurants where they have a set menu for a discounted price, and they donate a proceed to the food bank, which I think is an amazing thing that we do, but it helps you try out different restaurants around the city that you may not have access to when they're at their normal price. So I think that's a really cool thing to explore. But not even just restaurants. The theater scene is really great here if you're interested in that. We have lots of good parks. It is a little hot, especially right now, to go to the parks, but there's lots of things nearby too. It's like Austin, San Antonio, New Braunfels, Fredericksburg, all great little cities that you can check out that are not too far if you want to make a weekend trip. But I can't say enough about Houston. Our sports teams, I'm a dedicated, struggling Rockets and Texans fan, but Astros always awesome. I love going to Minute Maid, and I've actually been with my co-residents several times, which is awesome. So we always find ways to just have fun.
Love it. It's great when your city has good sports teams, or honestly any sports teams, because it's just like such a bonding experience for everyone to go.
It's true. I mean, I think my Texans are gonna really bring it back this year with CJ Stroud. So I'm really hoping that we have a great season.
We'll manifest for you.
Thank you.
A lot of people at A&M are big Astros fans and Texans fans and all the Houston things. So, okay, so just a few final concluding questions. So, tell us how we can learn more about your program. Do you guys have an Instagram,
Mhm.
website, anything, any place that we can find you guys?
Yes. So we have a resident run Instagram, UTH Derm. And then our website, you can just look up UT Houston Dermatology Residency. It'll tell you all about us. We haven't updated the current resident list this year yet, but we're on it. And yeah, you can learn more about all the residents, what we offer, all of our faculty. It's all on there.
Okay, great. Final two questions are getting advice from you. So, do you now, as a PGY4 derm resident, have any advice for medical students interested in dermatology?
I think it's hard. It's such a great specialty. I can't say enough great things about it. I think you just keep exploring, make sure that you find what you're really passionate about in dermatology, find something that makes it really worthwhile and really convincing to program directors or people reviewing your application that make that so that they can see why you love the specialty. And if you have a really compelling reason, it's hard not to turn anyone away because everyone wants to be at this in this great field. It's just so much fun. There's so many different things that you can do. And I think exploring all those different avenues in dermatology and finding what really clicks for you is the way to go.
Okay, and then last question, what advice do you have for med students in choosing a residency program? What things should they be looking for?
I would definitely look for location. I think being in a great place where you're going to see interesting, not only interesting derm things, but where you can have a really interesting life as well and never be bored and enjoy yourself throughout residency, because your life outside of residency is really what keeps you going sometimes. And I can't say enough about protecting your mental health. But I think location, diversity is really big. Make sure that you'll be able to get good training by seeing lots of different ages, skin types, conditions, populations, ethnicities, everything you want to see. In order to get really good training in dermatology, you really have to see a wide variety. And so I can't stress that enough. What else? Size of the program is really important. I think having a lot of people there, not only just to support you and to carry you throughout the whole 3 years is really great, but also having that support if you ever need coverage or if you ever need a hand from someone, they're always there for you. So I think those are 3 really big things to look for.
Okay, great advice. And thank you so much for
Thank you.
spending an hour of your day with us. We know you're very busy, but this information is very valuable for future dermatology, current dermatology applicants. So thanks again, Rachel. See you guys
Absolutely.
next time.
Thank you. Thanks so much.